UTI. What is a UTI, or what is called a urinary tract infection? These are among what we call the nosocomial infections, okay? Infections that are acquired from the hospital or a healthcare related center, okay? So on that list, we have a chronological order of these infections that are acquired. UTIs are first on the list, okay? Second to UTIs is what we call the surgical site infections. Coming third is what we can call ventilator-associated pneumonia. Coming fourth to that is what we can call septicemia or blood infections. Then lastly on the list is what we can call gastrointestinal infections, okay? But today my interest is to look at a UTI because it has been so common in the community where I work, or even in the health centers. You find it being a very common infection. So if you look at this, the urinary tract, first of all, what is it? This is what we call the urinary tract, okay? It consists of the upper urinary tract and then the lower urinary tract, okay? The upper urinary tract consists of the kidneys and their suprarenal glands that are actually retroperitoneal organs, okay? Then we have the lower urinary tract. It consists of the bladder that stores your urine temporarily before you void or before you undergo maturation to release the urine out of the body, okay? Then it consists of the urethra and its urethral opening. That is what it consists of. Now, if you look at what we call the urinary tract infections, usually this tract should be sterile. It shouldn't have any microorganism, or it should have few microorganisms that are actually washed out or avoided or even removed by what they call the host defenses or your immune defenses that we shall look at in a while, okay? So with that, you find that this tract should always be sterile. But what happens in the case of a UTI? A UTI, as it even sounds, an infection, refers to the presence of bacteria in the urinary tract, which is usually sterile, to give a pure positive culture of 100,000 organisms per ml of the urine sample. What do I mean? Look, pay attention. So a UTI refers to the presence of bacteria, okay? These are pathogens, we all know that. It can be bacteria, it can even be a protozoal infection, it can even be a fungi, okay? Because we know we had moniliasis, what today they call candidiasis, can also be one of them. But typically when they talk about UTIs, they are talking about bacterial infections in the tract. So this bacteria will give you a positive culture of 100,000, okay? 100,000 organisms per ml of the urine sample. This is what we call a UTI, okay? So basically that is it. I again repeat, a urinary tract infection refers to the presence of bacteria in the urinary tract, which is usually sterile, with a positive pure culture of 100,000 organisms per ml of the urine sample. That is how we call a UTI, okay? Basically, what are the causes of this UTI? First are the bacteria, okay? Most commonly. But what is the most common bacteria associated with a UTI? That is what we call E. coli or Escherichia coli, okay? Which is a gram-negative bacteria. Very, very stubborn bacteria. Second to that, we can have what we call Staphylococcus saprophyticus, okay? Staph sapro. This is the most common cause of UTI in young sexually active individuals, especially girls, okay? A history of a girl who's young. She has just begun to become sexually active. This is usually saprophyticus, okay? Very good. Then we have other highly motile bacteria, what we can call Proteus mirabilis, okay? We shall look at this, Proteus mirabilis. Very, very highly motile bacteria that is also gram-negative. Then we can have what we call Enterococcus fecalis. Enterococcus fecalis. We shall look at it. It wants to resemble fecal matter. This is where we shall talk about people, how to wipe the butthole, okay? What's the direction? Do you wipe from in front going backwards or backward going frontwards? And then you inoculate, okay? And by the way, these are usually gut bacteria or gut flora in the urinary tract, okay? Then we can have another common bacteria. So this one, usually it is there, we call it Providentia stewarti. Providentia stewarti or stewarti, depends on the primary school that you went to or elementary school that you went to. So then lastly, even to that list, we have what we call Pseudomonas aeruginosa. Pseudomonas aeruginosa, very, very common guy affecting wounds. Aeruginosa. Okay, so these are the causes of a UTI. First of all, the bacteria, when they are present in this tract, they cause those signs of a UTI that you see. Okay, so basically, these bacteria can be inoculated through the urethra or through the urethral opening. Okay, then they will ascend, affecting the bladder to cause what is known as cystitis, which is a type of a UTI. Then later they affect the ureter, and then they reach the upper part of the pelvis, okay, causing what they call pyelitis. Then later into the kidneys, causing what they call pyelonephritis. Okay, we shall look at that. So now, basically, what are the host defenses? How does your body defend you against this? Because it is not a common thing that you should just get UTIs out of nowhere, okay? There's a certain group of people that UTIs are so much common in. So now, basically, we have what we call the host defenses, okay? What prevents you from getting a UTI? We call them the host defenses, okay? So, basically, what are these host defenses, first of all? Number one is the urination, okay? Complete emptying of the bladder, wash out, okay? Complete emptying of the bladder. That is one thing that is very, very common, okay? It helps you because it flushes out the bacteria. Complete emptying of bladder, okay? It flushes out all the bacteria. For example, when you have urine here, and maybe you have a bacteria that is clinging onto this, okay? The wash out or the flow of urine will pass the bacteria down out of the body, and actually it will not ascend or it will not stay here to cause a UTI. That is one. Two is what we can call around the urethral opening. There is what we can call periurethral glands. Okay? These periurethral glands, they are very, very good. Periurethral glands. They secrete what is known as mucus around the urethral opening. That mucus is aimed, or its function is to trap the bacteria. Okay? It is to trap the bacteria, and actually we shall look at how it can be breached to cause a UTI. Okay? Then in your urine, we normally have an important protein that we can call uromodulin. Okay? Uromodulin is a very, very important protein in your urine. Actually, recent studies show that a depletion in the amount of uromodulin can predispose you to getting AKI, what they call acute kidney injury. We shall look at it. We shall look at AKI. So this uromodulin is a very, very important protein. Okay? Yeah. Then it is normally produced by the thick ascending limb of the loop of Henle, by the way. Okay? And it is coded for by a specific gene on chromosome 16. Okay? Then, lastly, we have other mechanisms of host defenses. Okay? But basically, these are some of the most important ones. Then we have a vesicoureteral valve. Okay? The vesicoureteral valves. So these ones, they are around here. Let us just take it like locks around here, okay? Locks around here. That if the bladder is contracting, the detrusor muscle is contracting, such that it pushes out the urine, it closes shut to prevent the reflux of urine back into the ureters and into the kidneys, preventing a UTI. Okay? So these are some of the mechanisms through which your body protects you from a UTI. Okay? So basically, the start of a UTI comes when these factors are breached or when they are not working well. You cannot empty your bladder very well, the infection will grow. Your periurethral glands are not producing enough mucus. Actually, what you can see in what they call estrogen deficient postmenopausal women. Okay? They lack estrogen. Estrogen is necessary for the growth of these glands. That is why they might be getting a UTI. That's why UTIs can tend to be sometimes common in people who are in the menopause. Okay, so I think you can relate. The mucus is not there to trap the microorganism. Then uromodulin, okay, very, very important, regulating, providing immune functions, okay, to the urinary tract. Then the vascular valves, okay, they prevent reflux of the urine. Now, after knowing this, okay, basically, how does the UTI come in? Okay, UTI comes in when these factors are breached, as I told you. And also, basically, we have host factors, okay, and then we have bacterial factors, okay, bacterial factors. So what are the host factors? When I say a host factor, it is something that is related to you. How? You can be immune suppressed or immune compromised. You can have, at the point of the kidney, you can have what they call kidney stones. Okay? They can predispose you. Kidney stones. Okay? What about the manners? What manners am I meaning? There are very many manners that people involve in to cause urinary tract infections. Multiple sexual partners. Multiple sexual partners. It's a very common one also. You can push the infection in. Okay? Another one, you can have what a pregnancy state. These are now like the risk factors. Pregnancy state. Why pregnancy? Because sometimes there's incomplete voiding or emptying of the bladder, okay? And also sometimes constipation is another risk factor. Constipation, it presses on that bladder, preventing its complete emptying, okay? Then, what else? The urethra, women, being female, okay? Women have a short urethra, okay? Women have a very, very short urethra of just 4 centimeters. But a man has how many? 20 centimeters. 4 centimeters of urethra. Very short. Okay? So these are some of the ones. Then the bacterial, actually another one here, a most recent one that I've done research on, is what they call the P blood group. I'll explain it. Pyelonephritis associated, or what we can call the bacterial, it codes for the bacterial fimbriae. Pyelonephritis associated fimbriae. It is present on the bacteria, but also here we have the P blood group. You find that the uroepithelium of the person contains those different antigens that the bacteria can adhere to, or surfaces that the bacteria can adhere to and ascend. Okay, so the P blood group, and this one is very common, is very good for recurrent UTIs. It explains. Then here, another thing here, we have the estrogen deficient postmenopausal women. Okay, it's another state that someone can have a UTI. Okay, so look at that. Very, very common. Then bacterial, here we can have resistance. Okay, resistance. They can have the fimbriae that are very, very resistant, and also the flagella. Okay, that enables them to ascend. So these are some of the risk factors. Okay, even not being circumcised. Okay, uncircumcised males. How does this come in? Uncircumcised male. You know, there is that whitish thing that we can call the smegma. Okay, if someone is not circumcised and they are not maintaining their hygiene, they can have that whitish thing on their penis, what we can call smegma. Okay, it is a mixture of bacteria, mixture of oils, and certain lubrications also that play an important role actually. But if you let it unclean, it can cause you issues, can predispose you to having a UTI. Okay, then also people use antibiotic abuse. Okay, people use broad spectrum antibiotics. You can get what is called a super infection. Okay, hence getting a UTI. So these are some of the causes. Okay, so these are the host factors. When they are breached, okay, you find that someone is going to get a UTI. So that one basically brings us to the signs of a UTI. How do you know? And another very important thing after antibiotics is what we abbreviate as CAUTI, okay? That is catheter-associated UTI, okay? Catheter-associated UTI. Very, very common, this associated UTI. What you find abbreviated as CAUTI, okay? So, with this, I would like to explain more. You know, catheters are being utilized. They use them in patients, okay? Some of these patients have urine retention, okay? Some of them can be having injuries of the spine and they cannot easily contain the urine, okay? Their nerves are damaged. They can't easily contain the urine within their blood, okay? So, any indication of use of a catheter. What does a catheter look like? This is part of a catheter, okay? And this is a demonstration that I'm going to do for you, okay? So imagine, how does this catheter cause a UTI, okay? This catheter causes a UTI in a way that it can be in multifaceted way. One is the inoculation, how you insert it, okay? The process of insertion, remember we normally have we have the periurethral glands, okay? The periurethral glands that are very, very important. So around the periurethral glands, sometimes you find bacteria there, okay? So as someone is inserting the catheter, what happens? Usually, as they are inserting the tip, okay, they can push microorganisms towards the inside. When these microorganisms are pushed, that is one way a catheter can lead to a UTI, okay? You're pushing the organisms around the periurethral organs or the gland into the urethra and the bladder, resulting into a UTI, what is called cystitis, okay? Then another way that someone can get a UTI because of a catheter is this. You know, this catheter, when you insert it in a patient, okay, for different indications, maybe even just to monitor the urine output that a patient might be bringing out. You know, if someone is at a risk, maybe if consider what they call the RIFO criteria for acute kidney injury, you find that sometimes you need to insert this to know that someone maybe is at a risk of AKI, okay? They will produce urine that is less than 0.5 mils per kg per hour over a period of 6 hours. So it is weight dependent and on how much the person is taking in, okay? So this is a urine bag that if you connect the other catheter I showed you, you must insert this towards its base, okay? Such that the urine can freely flow. But how do you attach this? You put it at the foot of the bed, okay? You don't put it on the same level. Why? Because if you put it on the same level where the patient is, sometimes the components, the urine that is here, can easily droop back and it mixes with the organism, can easily travel, okay? Especially those that form biofilms. Then another thing that I've seen so much, and I don't really feel good about, is that always in the hospitals, you're leaving these patients to be the ones, the caretakers. They're the ones who are emptying these things. You understand? And they don't know the precautions. It can easily cause a UTI. How? When you open this, for example, you see, it flows. So when it flows, imagine it has flowed. What do? You must always clean this area, okay? You get an antiseptic and clean this area before you insert it back, because even when you're using just your bare hands, sometimes if those caretakers, they don't use gloves, they just touch, then they push back. These organisms can easily be inoculated, but you as a healthcare worker, okay, put on your clean gloves, come, remove, empty it, and then put it back clean with an antiseptic, okay? That is one way, those are the ways this catheter can cause a UTI, okay? Biofilm, sometimes even when, it has a hole in it, sometimes it can be company induced. They can make when some of them may be defective. Then you find one with a hole. If you've not seen, organisms can easily use that hole to enter, okay? So, ways in which a catheter can cause a UTI. Number one, inoculation by the caregiver, okay? Two, improper positioning of the catheter. You're putting it at the same level with the patient. No, it must be down. Three, this, always clean with an antiseptic after you've done emptying the urine bag. And also don't let a catheter stay in place for more than 24 hours. Don't do that. Let the person have it for 24 hours. After 24 hours, remove, throw away, okay, to prevent UTIs. So that's a very, very common one, very common something there that you should pay attention to, okay? Then, lastly, we shall look at, in this video, we need to look at the types of UTIs, okay? Then in the next video, I'll go straight and I dive into each. Types of UTIs. Basically, we have three. We have what we call asymptomatic bacteriuria. Asymptomatic bacteriuria. Bacteriuria. Then we have cystitis, okay? Cystitis. And then lastly, we have what we call pyelonephritis. Good. So these are the types of UTIs. In the next video, I'll be describing each into detail, the different subtypes and how we diagnose them and what are their signs and symptoms, okay? So stay in. Thank you.